So once we had our momentum in the preventive services in the Affordable Care Act, we knew we also had to move forward in those folks who have chronic diseases. We didn't have time to include VBID in terms of managing chronic conditions like depression, diabetes, cancer, heart disease. And we fought very hard, again, mostly toward a grassroots approach, to further incorporate VBID concepts of high-value services should be low cost and low-value services should be higher cost in multiple settings. The biggest challenge for us was Medicare, because 98% of Medicare expenditures are not on screenings and prevention. Most people over the age of 65 have one, if not 7, 8, or 9 chronic conditions. When we tried to advocate to include VBID in Medicare, we learned quite quickly that in 1965, when Medicare was passed, there was something called the Anti-Discrimination Clause, that every American Medicare had to have the same benefit design. This flies directly in the face of the VBID idea that some things should cost some people less and some services should cost some people more. So I was told by people in Washington that this would take an act of Congress, which I interpreted meaning get back on the plane and go home to Ann Arbor. But stubbornly, we persisted and continued to advocate in saying we need to try value-based insurance design in Medicare. We introduced bills in both the House and the Senate to allow a demonstration of VBID concepts in the Medicare Advantage program, and it actually passed the House, one of the very few bipartisan ideas to pass the House in 2015, and getting that signal that there was support from both Republicans and Democrats, the Obama administration approved a Medicare Advantage value-based insurance design demonstration in 7 states and in 7 chronic conditions, which began January 1 of 2017. And that's not all. The idea was so well received that even before the program launched, the Obama administration expanded the VBID Medicare Advantage demo to 10 states, including Michigan, which we fought very hard for, and expanded to additional diseases. Even more excitingly, as healthcare becomes the most partisan, rhetorical, and controversial issue, there is bipartisan support to expand the VBID MA demo to all 50 states. Both the House and the Senate have introduced bills in this Congress to allow value-based insurance design to be practiced in Medicare plans in all 50 states. We're very enthusiastic to see this movement, and that value-based insurance design is one of the very, 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 very few healthcare reform ideas that has support of both Democrats and Republicans in the U.S. political sphere.